Got out of the Marine Corps in 1984, and the Dan Paris, the guy that got the first U.S. patent for LED light therapy in 1983. I've known Dan since I was a child. He called me. I went to work for him. When we started, the device was a single LED, and that was a 1 milliwatt LED, pulsed at 50%. Here we are today, 40 years later, and 40 plus years later. And now we've got, multiple different wavelengths of light. Everything has changed. It's totally different than where we started. I mean, electronics were a lot more rudimentary than they are today. When we got the process done, we were the first. There was no other LED light therapy products at the time. I mean, now it's changed. At the time, it was called an experimental device exemption, or an IDE. And at that time, you could sell about 100,000 devices to see if it was safe and effective. Now you fast forward, I think about 5 years ago, and they became ILY. The FDA removed all of the regulations. It's no longer an experimental device. It's now been found safe and effective. So I think that's the real difference. We started at the beginning. We're the ones that got it approved. We're the ones that started the whole thing. I mean, it was only in the last 10 years or so that, due to deregulation, all these other companies could jump in. And due to that, they don't have to do the things we had to do. They don't have to do UL testing or regulatory testing. I see light therapy, it's going to keep advancing. We're going to see more wavelengths of light, but I actually see it going internal. They've recently come out with a LED device that's the size of a little capsule, and that is to be implanted in cancerous tumors. You just look at where it's come. I mean, when we first did this, the FDA, they didn't want us to put it over active tumors, anything like that. I mean, it was an experimental device, but now it's been safe and effective enough to be implanted in. So I just see it getting smaller. I see it getting better. I mean, I see it honestly. I mean, you look at it, we should be able to make a device the size of a blood cell that you could actually inject in, that would float through your body. Uh, look for look for areas that need circulation. I just see it constantly improving. Right? I mean, I look at it and, it came from a single LED at 1 milliwatt. And today, multiple wavelengths, multiple frequencies, it's just going to keep improving. And the more research done, the more research will be done. This product's safe and effective. I think that's the biggest thing. And that's probably, for me, one of the greatest things that's happened is that the FDA found this safe and effective for everybody to use.